COVID-19 has imposed a heavy toll on college students' lives and the social connections they have with others. Now, as colleges and universities reopen in the midst of this devastating pandemic, it is important to think about how students will try to reconnect and resume their lives on campus. As a parent or guardian of a college student about to begin or return to campus, you may be thinking about how your student will react to the stresses and restrictions caused by COVID-19. Many experts predict that with college campuses trying to return to normalcy, some students will overemphasize the social aspects of college life. Will your student want to make up for lost time? Will your student feel a desire to party in excess? How will this impact your student's consumption of alcohol? Not everyone drinks when they attend college. About 1/5 of the student population chooses to abstain from alcohol, while others drink infrequently and in moderation. However, studies show that hard alcohol is the most widely misused drug among college students. According to the National Institute of Alcohol and Alcohol Abuse, about 1/3 of college students drink in hazardous ways, meaning for men consuming 5 or more drinks or women consuming 4 or more drinks within 2 hours. Overconsumption of alcohol, especially hard alcohol, is the major contributing factor to student injuries, deaths, hazing incidents, sexual misconduct, physical assaults, and vehicle crashes. As a parent or guardian, you are the best source of advice for guiding and influencing your students' decisions regarding alcohol use. You can make a difference in their choices. Studies show that parents continue to have influence on their children even after college years. Share with your student that you have confidence that they will be responsible and make good choices regarding alcohol. Conversations about drinking alcohol, when done early, openly, and often, can be most impactful. Although these conversations may be uncomfortable for you and your student, these conversations are invaluable. This might be one conversation or a series of conversations that help shape your student's view on alcohol consumption, and if your student decides to drink. Your first conversation may start simply with, "Have you thought about how you will make new friends or reconnect with old ones on campus?" Try to relate to your student and respond with an open mind. Begin the conversation from a place of caring. You'll feel less stressed and your student will be more open to the conversation. Ask open-ended questions such as, "People are predicting that some students will want to make up for last year by going out more and drinking a lot. Do you think there will be more parties? How do you feel about that? I hear drinking is a big problem on college campuses. Have you thought about what you would do if one of your friends or classmates drank too much? What do you think will be different about your fraternity or social circles this year?" As your student opens up, you have the opportunity during your conversations to remind them. Be a good friend. Don't encourage, pressure, or force another student to drink alcohol, especially shots. Stay safe by sticking to their decision about how much to drink, even if others pressure them, and be sure to always have a designated, sober driver. There can be academic, health, or legal consequences to their actions, especially if they buy or provide alcohol to anyone underage. Look out for signs of alcohol overdose. Alcohol overdose is one of the most important things to discuss with your student. Many students fail to understand that you can overdose on alcohol, which may lead to death. Nearly all student deaths from alcohol overdose could have been prevented had a fellow student recognized the danger signs and called emergency medical services. Encourage your student to look out for signs of alcohol overdose and to take the appropriate action by calling 911. PUBS is an acronym and a useful tool to identify alcohol overdose. The Gordy Center's PUBS sign of alcohol overdose are puking while passed out, unresponsive to pinching or shaking, breathing is irregular, slow, shallow, or has stopped, and skin is blue, cold, or clammy. If a person has darker skin, check for pale lips and look at their nail beds. If your student sees even one of these signs in a person, they need to call 911 for help and seek emergency medical assistance immediately. Whether your student is on campus for the first time or is a returning upperclassman, you play a major role in helping your student develop a healthy mindset about drinking in lower-risk ways. Make it clear that deciding not to drink in certain situations or not at all is always a healthy option. Talking about alcohol with your student is not a one-and-done duty. Bring the topic up several times during the year. Consider sending them text reminders before weekends to be careful, to not drink too much, and that you want them to be safe. Your discussions could impact your students' choices about alcohol use for a lifetime. If you have any concern about your students drinking, there are numerous resources for you to get help. For more information, visit the websites of the National Institute of Alcohol and Alcohol Abuse, the Substance Abuse and Mental Health Services Administration, the Fraternal Health and Safety Initiative, and the Gordy Center at the University of Virginia. If you feel your student's fraternal organization places too much emphasis on alcohol, contact the chapter advisor, the national headquarters, or the University Fraternity Sorority Advisor. Thank you for promoting a safe and healthy environment for your student. Your positive influence will make a huge difference. Your students' safety, health, and welfare remain our most important mission. Thank you for your assistance and support.